Makerere University Environmental Health students have introduced you a video titled Antimicrobial Resistance in One Health. Antimicrobial resistance occurs when microbes that causes different diseases become resistant to antimicrobials. For instance, when bacteria mutate, no longer responds to antibiotic. When virus mutate, can no longer respond to antivirals. When fungi mutate, they can no longer respond to antifungals. And parasites mutate and can no longer respond to antiparasites. This makes infection harder to treat, thereby increasing the risk of disease spread, severe illness, and death. Since medicines become ineffective and infection becomes increasingly difficult or impossible to treat. One Health is a multi-sectoral and transdisciplinary approach which brings together sections and stakeholders engaged in human health, animal health, plant health, and environmental health, like doctors, nurses, veterinarians, agricultural workers, environmental health scientists, law enforcement, policymakers, community members, to communicate and work together in the design and implementation of programs, policies, legislation, research to attain public health outcomes.
Jackie, here are your scholastic materials. You need to get ready for school.
I'm not seeing my medicine.
You are looking for me. Oh, you left it on the table on the bedroom. No, it is not you. These are just materials for the school. Let me go in
Yes,
our
but I
bedroom.
packed it.
Let me go. That's why you will get your medicine here.
Yes, I did check for me.
Yes, Doctor, are you ready for school? Are you ready?
Yes, mommy, but
But what's happening? You're unpacking everything. What's going on? You're going to be ready for school. I'm also going to be ready at work.
Mommy, I'm not seeing my medicine. I put it somewhere.
Which medicine? Which medicine? You should really go to school. You should really go to school or something.
Now when you give me
That one. So this is now. You should go to school, Jackie.
no, mommy, this is the medicine you gave me at the beginning of the holiday. It's not enough. I've been taking it the entire holiday. Have you heard of any complications from me? No headache, no cramps, nothing. I've been taking my medicine so perfect. So mommy, just add me some medicine.
Look at it. Mention a bit.
Yes.
She takes medicine. She doesn't have to listen.
Yes,
But I
mommy,
think I'm going to be so late. I think I should call your auntie to get you some medicine.
Yes.
Auntie, morning.
Yes, and
Come.
I've seen it, auntie.
I was going to take Jack to school, but
wow.
I think I'm so late. So you're going to help me take her to school. But she has complained about her medicine, so you're going to pass by the doctor to get some medicine.
Okay.
Any antibiotics that you feel like you can get for her.
Okay. I'll get your medicine.
Let me give you some cards.
Okay. So I'm going to get your medicine.
Yes.
And you're not to get the state.
Yeah.
Yes.
So you can get any antibiotics.
Okay.
And your doctor knows. So you just tell her that you want medicines for Jackie.
Okay.
I think I'm giving you Jackie your medicine.
Yes, bye. Bye, mommy.
Yes. So now I'm going to go to the doctor right now and get your medication.
Yes.
When I come back, I want you to be ready.
Yes, I'm going to pack the things I
Bye.
can.
So
Yes.
let's go. In a few minutes, I'll be back.
Okay, auntie.
Oh,
Yes,
morning.
doctor.
Wow, nice to meet you.
Yes, doctor.
How are you, my friend?
I'm good, doctor.
How is life?
My life is good.
Oh, that's good. How is my daughter?
Your daughter Jack is also fine.
Oh, that's
And
good.
she's going to school today.
Is she going back to school today?
Yes, and doctor, you know her things.
Yeah, you
Without
know.
medicines, she cannot start school.
Oh, I know school life. She needs
So,
medicine.
I come for some medicines.
Okay.
I come for antibiotics.
I'm going to get you antibiotics and I
Okay.
have more
the one you usually give us, doctor. Yes.
But I have a new one, it also works.
Okay.
This one works.
As long as they are antibiotics, I don't care.
I think this will work for you.
Okay, doctor.
Yeah, it
Thank
will
you
work
so
for my
much.
daughter.
Thank you.
You are welcome.
Bye, doctor.
Bye.
She'll be
Say hello to
fine.
my daughter.
Okay, doctor. She'll be fine at the time.
Oh, okay.
I can't believe you're so sick from this accident. When is Dr. Fatumah?
Oh, I'm here.
Dr. Fatumah, do something. Please, darling, please. I want her to get well. Please, doctor. Please, doctor, this is my only daughter. Please, do something. My daughter. Jackie, please get well.
Just cool down, honey, Jackie.
Well, I can't cool down. This is just simple malaria, but I don't know, doctor. Doctor, what's happening? Does she have malaria?
Mommy, Jackie, just cool down.
Does she have
Maybe give
malaria?
me some space.
All along we've been treating malaria, and she has always been getting well.
She's going to be fine. Please cool down.
Please give her malaria medications.
Yeah,
I need her to get well.
I'm going to give her. Just cool down, Madam Jackie.
But what is happening? Just simple malaria and she's not getting well. Please, doctor, do something.
Mommy, Jackie, give me some space. I'm going to treat your daughter.
Okay, doctor.
Yes.
Okay, doctor, I'm coming back to see if she's fine, doctor.
What's wrong with this girl? I'm even no longer feeling her pulse. Let me check. Oh my God, what's happening? I think I will no longer manage this situation. I need to call Dr. Jemba. Hello? Dr. Jemba. I'm in ward for I need you very urgently. Something is wrong. Jack is not fine. I'm not feeling her pulse. Yeah, please come and help me. Thank you. Oh my God. Having malaria. I need Dr. Jemba to come in a hurry because this situation is terrible.
Yes, Dr. Fatumah,
Oh,
called
thank you for
nutrition.
coming.
What's
I need
happening?
help. This girl is very sick.
This,
Yes, very sick.
what is she suffering from?
Malaria.
Malaria?
Yes.
How has been her
She has been having
condition?
malaria for 2 months.
2 months?
The nurse just called me.
How has been her dosage?
The nurse just told me, please first check. The girl is having. Oh my God.
Doctor, she going to be fine.
How has been her condition?
Doctor,
She has been sick, having malaria 2 months.
2
What's
months,
wrong?
that's antimicrobial drug resistance.
Are you sure?
Yes. The pathogens no longer respond to the drugs. But you have been the doctor for their family.
Yes, I'm the doctor. I'm their family doctor.
That means you have been giving her those drugs for all that period of time.
Yes, I've been giving them.
Then you are responsible for her death because she's dead, and
Dead?
it's because of you, because of antimicrobial drug resistance.
Did I hear that right?
Madam, everything will be okay.
What? Doctor, please first repeat what you just said, please, doctor. First repeat.
What's the problem, Aunt?
I heard doctor saying that she's dead. What I had was right. What I had was right. I should do something to end this. I think this problem is not only happening to me, but there are many people that are happening. That are going through the same situation. I should end this. I should what happened. I heard Dr. Jemba clearly that you were the root cause of this death. I want you to tell me that I'm going to sue you, I'm taking you to court. Can you explain, because I want the life of my daughter. Can you explain about the antibiotics that you've been giving her? Don't you know the guidelines that you're supposed to follow as doctors? I really want my life of my daughter. I want her life. I'm taking you to court.
The accused, Dr. Fatumah, stands indicted on a charge of issuing non-evidence-based prescribed drugs, which is contrary to Section 13 of the National Drug Policy and Authority Act. The accused violated the importance of the prescription book and acted contrary to the Code of Professional Ethics, Section 29B. The accused advocated for preferential use of antibiotics that renders the pathogen resistant to medication, leading to antibiotic resistance and sequential failure of the patient's body to respond to treatment, thus causing her death. The accused passed prescription without basing on the history and clinical signs, and further proceeded prescription without any appropriate investigation, thus violating Section 9C of the Code of Professional Ethics. Section 9B of the same guidelines was also violated, where documentation of the clinical findings and investigations was not done. It is the case for the prosecution that Dr. Fatumah has been issuing out drugs to patients under the listed conditions for the past 3 years on acquisition of her practicing license. I find that beyond reasonable doubt, the prosecution has proved the case of using non-evidence-based prescribed drugs issued by Dr. Fatumah as being the cause of the death of Ms. Jalidah's daughter. In full agreement with the anonymous verdicts of the assessor's hearing, I find the accused guilty of offense of issuing out non-evidence-based prescribed drugs to her patients and convict her accordingly. The drug authority should revoke her license for having contravened the provisions of the National Drug Policy and Authority Act, Chapter 206. Court adjourned.
Dr. Fatumah, what have you just done? This should end on a serious note.
What have I done?
Don't you know that it's not good to issue out drugs which are not evidence-based prescribed to our patients?
My friends, those no longer works these days. Cash works a lot. I have 5 kids to look after. They have to go to school. Then what do you expect me to do? They have given me money. I've given them antibiotics. We have exchanged. What's wrong there?
Don't you know antimicrobial drug resistance?
Of course I know. Then what?
What have you done towards its ending? As doctors, it's our role to end antimicrobial drug resistance. It's a serious burden globally, whereby 7,000 people are dying because of it, and it spends much money to recover its side effects.
No big deal. My kids have to go to school.
Your kids have to go to school, but it's the role of us doctors, me and you, to end it, and it should end. Please end it now. It must end. It must end.
My fellow clinicians, take me as an example. I'm not serving a punishment for giving out drugs that are not evidence-based prescribed.
I'm so happy. at least justice has been served.
The skit has been offered by students of Environmental Health Science, School of Public Health, Makerere University. It shows how we human beings have played a big role in increasing the burden of antimicrobial resistance. However, I call upon individuals to stop self-prescription, clinicians to stop non-evidence-based drug prescription, and policy implementers to implement laws that govern drug prescription. Thank you.
Together, we can fight antimicrobial resistance.